was the motivation for you to do this, to bring it sort of here to the present? Because I know that's, you're always thinking practically in those days. What can we learn?
I think it helps us identify what sort of parts of our public health enterprise at Brown are actually kind of core to how we should be doing things. I think that commitment to kind of applied translation and practice and being able to uplift practice as being just as important as other kinds of scholarship, I think, is tremendously important. You know, to be able to see a community engagement roadmap for the university that puts equal weight on those kinds of contributions to the traditional scholarly contributions is one way we've been able to do that. But I think particularly, I've been at the School of Public Health almost 10 years now. It's no secret, we've gone through a lot of changes and growing pains over the years. I think there's a real need for us to understand that that commitment to practice, the commitment to impact, allowing our students to get real hands-on experience in the world is sort of at the core of how we've always done things. And that it's about making room for those things again and making the administrative and financial decisions that have to be made to make that the cornerstone of how we do things, because it is so core to who we are. You know, I think I heard for years, well, we're not Harvard, we're not Hopkins, we don't have this long history. We do. It was waiting for us to go and find it. And so I think, if anything, it's a grounding exercise for the work ahead of us. We can't know where we're going if we didn't know where we came from. And identifying that these have been things that we've been good at, praised for even over the centuries, I think is something worth taking stock of as we make decisions going forward.